Bismillahirrahmanirrahim. Quote of the day: Be patient, for what was written for you was written by the greatest of writers. Assalamu alaikum. Today, the topic of my presentation is smallpox, which is one of communicable disease under kind supervision of my supervisor Professor Dr. Saira Afzal. Learning outline of today's presentation is about introduction, mode of transmission, a level of prevention, efforts towards eradication, and updates. And at the end, there is an MCQ session. In the end of this presentation, participants will be able to describe about smallpox infection and efforts towards eradication. The organism that are responsible for spreading the disease of smallpox is one of double standard DNA and belongs to a orthopox virus family. And some other categories of these families is variola, cowpox, vaccinia, monkeypox. There are smallpox disease is spread in two forms, variola major and variola minor, and it also stable outside the body. And it retains its infectivity and remains stable outside the body of the host. Last case was presented in 1977, and this disease was completely eradicated from the world according to World Health Organization in 1980s. There are different mode of transmission of this disease. Person to person with the help of inhalation of droplets, direct contact with infected body fluids, scabs, the remaining part of pox which are appeared on the body it until remains scab and then its fall off. Contaminated objects like bedding, clothing, and bandages. Aerosol is the rarely mode of transmission and spread more easily in cool, dry winter months, can be transmitted in any climate. There is no transmission by insects or animal. Transmission from a smallpox, it is in a prodrome phase is less common. A fever, and if there is no rash on the body, then there is a less chance of transmission. And its most contagious form when the rash is onset and the first 7 to 10 days. And it remains contagious until last scabs falls off. Incubation period range from 7 to 17 days or 12 to 14 days. And the initial sign of this disease is small red spots in mouths and on tongue. And the rash on face spreads to arm, legs, hands, feet, and it's in its centrifugal distribution, entire body covered with the rash within 24 hours. There are two categories of smallpox virus, variola major and variola minor. In variola major, most common and severe form, extensive rash on the body and high fever. There are different categories of variola major like ordinary, modified, flat, and hemorrhagic. Hemorrhagic is early and maybe late. And in ordinary type, there is a discrete, confluent, and semi-confluent. And in variola minor, this is less common and less severe form of disease. This is the discrete form of variola major, in which pustules separate and not merging with one another, most common form of smallpox. And in semi-confluent and confluent form, pustule begins to merge, and in confluent form, pustule joining and becoming confluent. And in hemorrhagic form, less than 3% of all cases. There are two types of hemorrhagic form, early and late, and deaths occur before pox lesions appear because it is very fatal for the body. This is the form of variola minor, which is less severe and less common. Variola major, there are ordinary cases are more, 20 to 40% case fatality rate. Flat and hemorrhagic form are usually more fatal, and the Uh, Prognosis of variola major is very poor. Complications that are retained is blindness and limb deformities. And in variola minor is less than 1% case fatality rate. And the recovered cases from smallpox produce a lifelong immunity in the body. This is the disease pattern of a smallpox in which rashes appear and it remains in pre-eruption form. Then a papule and vesicles appear and a pustules form and until the scabs fall off from the body. And this is the fever, how it goes on with the rash. And then when scabs fall off, the fever also touches the baseline. How will we differentiate smallpox from a chickenpox? 2 to 4 days before the rash, smallpox fever appear and chickenpox fever at the time of rash. Pox at same stage, pox in several stages. Its development of rash is slow and the development of rash is rapid. Distribution more pox on arms and leg and more pox on body. Usually present on palms and sole, and in the chickenpox usually the rash is absent on palms and sole. More than 10% of cases reported with death in smallpox, and it is very uncommon case fatality rate in the chickenpox. There is a four level of prevention in which we prevent the disease, and in a primary prevention there is a health promotion and a specific protection. And in health promotion, we educate the people wearing mask, habit of cleanliness, and isolation of a positive case in case of smallpox. And then comes the specific protection. In case of smallpox, there are two techniques which are used for their protection. One of isolation and other is variolation and other is vaccination. Variolation is a technique that is used before the development of vaccination. In a variolation is a process by which material from a smallpox pustule was given to a people who had never had smallpox. This was done either by scratching the material into the arm or inhaling it through the nose. With both types of variolation, people usually went on to develop the symptom associated with smallpox, such as fever and a rash. Then the vaccination is in the developing phase. The base for vaccination began in 1796 when an English doctor named Edward Jenner observed that milkmaids who had gotten cowpox did not show any symptom of smallpox after variolation. The first experiment to test this theory involved milkmaid Sarah Nilbs and James Phillips. And then when the development of vaccination is occurred, then this disease is cured with the help of vaccination. This is a live vaccine virus administered using bifurcate needle, not an injection, dipped into vaccine and then prick the skin 15 times in about 3 seconds in 5 mm radius, administered into a superficial layer of skin given on right side universally. This is the primary vaccination site reaction in day 4, in day 7, in day 14, and day 21. You can easily identify the person who got the vaccination of a smallpox with the help of this lesion or reaction. This is a US outbreak control strategy, which is known as a ring vaccination. It is used in the outbreaks of smallpox, in which first they identify a cases, then contact to cases, and then contact to contact. So this strategy, preventive strategy, is known as ring vaccination. Contraindication for a vaccination of smallpox: eczema or atopic dermatitis, skin condition like chickenpox, herpes, psoriasis, or shingle. If you have a weakened immune system like transplant, chemotherapy, HIV, and some other chronic diseases, pregnant women less than 18 years of age, breastfeeding mothers, if exposed, then get vaccine no matter what the condition you have. Then comes the secondary level of prevention, in which you can early detect the disease and treat the patient. A traditional confirmatory method with electron microscopy or vesical fluid culture on chick membrane or cell culture, and a new rapid test is available only at a reference lab, PCR and rapid electro. The CTZ proposed the evaluation criteria to clinician to rule out the patient with a rash, major criteria or a minor criteria. In a major criteria, febrile prodrome phase, classic lesion appearance, and in a minor criteria, there is centrifugal distribution, slow rash evaluation, and toxic appearance. And there is a specific treatment. There is a no specific treatment of a disease, and you can only supportive medical care give to the patient and isolate a person until all scabs have fallen off. Now it's time for the updates. WHO smallpox eradication campaign begins in 1967 worldwide, and then it continues till 1975. The end of smallpox, October 26, 1977. Last case of smallpox, and May 8, 1980. Official declaration of WHO, and smallpox is eradicated from the world. Last case of variola minor is reported in Somalia, 1977. And the last case of variola major is reported in Bangladesh, 1975. Which factors are responsible for the eradication of this disease? In 1959, the WHO initiated a plan to get rid the world from a smallpox. The intensified eradication program begins in 1967. Laboratories produce more higher quality freeze-dried vaccine, production of bifurcate needle. There is a start of strong surveillance system, and a campaign of mass vaccination campaign started. Why this eradication becomes successful? Because vaccine is available in a large bulk. There is a no animal reservoir of this disease. Vaccinated person easily identified, and a disease also easily identifiable. The smallpox is also known as a bioweapon potential. Prior attempt to use as a bioweapon potential, French and in Indian wars. British gave Native Americans infected blankets. Allegation of use in US Civil War. Alleged use by a Japanese in China World War II. Why it is called that the smallpox fluid is a bioweapon potential? Because it can be produced in large quantity, stable for storage and transportation. It produces a stable aerosol, high mortality rate once the person get infection. Person to person spread is its major mode of transmission, and most of the world has little or no immunity. So it is a threat that a smallpox material is used as a bioweapon potential. The goal of smallpox research is to address 3 areas that are essential for public health: finding better antiviral drugs to treat smallpox disease, make safer vaccines, improving tests to detect variola virus. All research using variola virus is overseen by WHO. The WHO Advisory Committee on Variola Virus Research reviews the research that proposed each year. There are 2 WHO designated sites where stock of variola virus are stored and used for a research: CDC, Atlanta, Georgia, and the Russia State Center for Research on Virology and Biotechnology, Russian Federation. Now it's time for the MCQ session. Smallpox was a viral disease, and it spread through close contact with infected material. When smallpox is most infectious, Once sore develop in mouth, once sore develop in throat, once rash develop, increase in temperature of the body, once scabs fall off.
C.
C is the right answer, once rash develops. Smallpox is completely eradicated and there are no cases of smallpox anywhere in the world. Which number of cases should be considered for outbreak? 1 case, 10 cases, 100 cases, 1000 cases, or 10,000 cases?
B.
No, it's 1A, because there is no case of smallpox anywhere in the world. So if the one case is reported, we consider it as an outbreak. Smallpox was very contagious disease. Which symptom initially reported by patient in OPD settings? Rash, fever, headache and body aches, vomiting or diarrhea?
Fever.
B is the right
B.
answer, fever. Yes, fever is the right answer. There are multiple stages of sign and symptom of a smallpox. Which trace of smallpox often remains after the infection ends? Chronic fatigue, poke marks on the face, blindness, sensitivity to skin, sensitivity to sun, allergic rhinitis.
B.
B.
B is the right answer, poke marks on the face. Initially, variolation was done for treating the patient of a smallpox and then vaccination was started for treating the patient. Which type of needle is used for vaccine the patient? By 5 cc injection, by a single needle, by two-prong needle, by 10 cc injection, or a 20 cc injection?
B.
No, C is the right answer, by two-prong needle. Eradication of smallpox was a big challenge for WHO at that time. Target has been achieved due to which of the following epidemiological facts? Highly effective vaccine, no long-term carriers, easily case detection due to rash, elimination of an animal reservoir, and effective surveillance system.
B.
B is the right answer, elimination of animal reservoir. Working on the synthesis of vaccine started after 1780. The vaccine used to eradicate smallpox originated as live smallpox, live cowpox, genetic recombinant, killed whole virus, frozen vaccine.
B.
B is the right answer, live cowpox. There are various types of variola major. Which type of variola major have case fatality rate more than 95%, ordinary, modified, malignant, hemorrhagic, or a discrete type?
C.
B is the right answer, modified type. Multiple outbreak reported throughout the world before its eradication. There was multiple preventive strategies used for the control. What was the name of US outbreak control strategy? Ring vaccination, variolation, active surveillance, passive surveillance, or a mass vaccination?
Alpha.
A is the right
E.
answer. A is the right answer, ring vaccination. Before the development of vaccine, the technique which was used for the control of outbreaks is variolation, inoculation, immunization, or induration.
Alpha.
C.
Alpha is the right answer, variolation. This is key of my MCQ. Today's link of this presentation on YouTube channel. And thank you.
Thank you very much, Dr. Naila. Very nice presentation. And the most important part that you have covered is about the ring vaccination. And we know that the ring vaccination is a strategy that has not only used as a first line strategy for chicken pox, but also for smallpox. And the smallpox is one of the disease that is the public health victory, and many of the precious lives that have been saved by the ring vaccination for smallpox. The ring vaccination is the first line strategy, and we know that the people who are vaccinated are in close contact with those who are having the symptoms of the disease or have the full blown disease. This way, everyone who has been or could have been exposed to a patient with virus receives the vaccine. So it is very important that we know the differences between the mass vaccination and the ring vaccination, because in the middle of any outbreak, large number of people are involved. So the mass vaccination is the prevention of choice, because it decreases more deaths rather than ring vaccine. However, when there are limited resources and when the vaccination contacts and their tracing that is present, the ring vaccination approach is more useful in places. So as you have said in one of your MCQ, that US is one of the situation where there are more resources, there are more educated people, and there is a system of surveillance in place where all the symptoms can be recorded. So the ring vaccination is the best approach, because it would decrease the spread of the disease and help in finding out those people who are in close contact with the people. You have known that in COVID we have again applied the mass vaccination strategy. So there are many questions that why the ring vaccination has not been applied. But I have already told you about how the ring vaccination work. So because we know that the deaths can be prevented both by ring vaccination and mass vaccination, but it is the resources, the surveillance, and the strong public health office, and how they are working together in integration with other important stakeholders that would determine that ring vaccination has to be used or the mass vaccination. So whenever there is any outbreak of any important viral infection, always investigate the person, time, place involved in exposure to the virus. Then quickly survey who needs to be included so that the ring vaccination or the mass vaccination can be decided. And there is always and always a great room for research. So evidence based practices so that the infected people can be separated, and those who are at the risk of infection or who are in the secondary attack rate, or who are present for a certain period of time, those people should be identified and they should be given vaccine. We also divide here the primary contact, that is someone who is directly exposed to someone who has the virus, as well as the secondary contact, the person who is in close contact with primary contact but not directly with the sick person. We have seen the doctors, nurses, paramedical staff, they are in direct contact with most of the patients. However, there are certain other people who are relatives of the sick person, but they have not come to the indirect contact, or similarly the family members. So these are very important assumptions in order to make before deciding whether the mass vaccination has to be done or the ring vaccination. Second, you have done a very good example of variolation. Again, variolation is one of the technique that has saved many lives, and we know that Edward Jenner was the pioneer of this technique, and he was able to develop the smallpox elimination from his area through variolation technique. However, it is obsolete with time now, and we have very safe vaccines that are available. So the variolation is not performed in most of these settings because of its very severe side effects. So here are this now this house is open for discussion. If anybody has any question, please do ask here. Okay, thank you very much. Thank you, Dr. Naila, for a very nice presentation. Allah Hafiz. See you, inshallah. Allah Hafiz.
Khuda Hafiz.
Allah Hafiz.
Thank you.